regional training hubs have a number of resources for medical students and junior doctors. This includes the Regional Medical Training website, where you can map out your specialty training pathways.
I received a bursary from the Regional Training Hub to allow me to complete advanced paediatric life support training. It's really helped me become more confident in managing critically unwell patients. I love doing my job and I love the variety of patients that I get to see. You don't get lost in the system working rurally, and I think that your learning experience overall is better for it.
The sim labs in Mildura were spectacular. The nurse educators knew absolutely everything. They taught us so much before we even hit the wards that we felt competent, we felt safe. The hub has really helped me realise that there's so much on option that I can stay in the northwest. I can train here, I can train in Mildura and rotate through, and that's something that really excites me.
Studying medicine rurally has been really exciting. It's like a bit of an adventure. You just never know what's going to walk in the door. So Dr. Paul has actually been my personal GP for about 18 years. Now I'm fortunate enough that he is someone who will be coaching me and mentoring me through my medical career. So just recently the Monash Hub sponsored me to attend the Victorian Rural Health Conference. It was a great weekend of gathering of rural doctors from Victoria and interstate.
I've been involved with the training hubs here at Monash for the past year, 2 years. Things that I've benefited from personally are things with my CV, so interview prep and training, people looking at my CV and giving me advice on how I can build it further. There's the Drivers Conference, which has a focus on presenting research and emphasising research from regional areas and rural areas in Australia. You have a lot of opportunities to sort of develop yourself as a clinician, as a researcher, as a person. It's a great boon to have the hubs be so involved and so accessible here for people who work here.
If I was a junior doctor in my current role in the city, where there's an oversaturation of trainee doctors, I wouldn't necessarily get the same clinical experiences that I get now. I get to interact here rurally, directly with consultants, and I get to do a lot of the interesting clinical work. And talking to specialty units and really nutting out what we think's wrong with the patient and what we think needs to happen for them. It really helps you grow and learn and feel like you're a doctor.
Monash Regional Training Hubs provide that missing link in the medical training pipeline, from when you go to a clinical school, an internship, and then trying to transition the training so that you can achieve all of your dreams in whatever career pathway you want by facilitating training locally. I love living here. I love working here. And I really want to share that with our medical students and our junior doctors.
We're developing pathways so that medical students can continue from finishing their medical degree to become specialists in a general practice or in one of their specialties. It enables the student to live locally, grow locally, and train locally.